Welcome to your recorded Postnatal Pelvic Health webinar. This webinar has been designed by the Herts and West Essex Pelvic Health Service. My name is Beth and I'm a Perinatal Pelvic Health Physiotherapist. So the contents of the webinar, we will discuss what is the pelvic floor and how does it work, how to look after yourself postnatally, what to expect in the early days and weeks, how to spot the signs when your pelvic floor is not supporting you well, and where you can seek further support. So first of all, what is the pelvic floor? The pelvic floor is a group of muscles that span the bottom of the pelvis and support the pelvic organs. They also give you the ability to control the release of wee, poo, and wind, and to delay emptying until it is convenient. When you contract your pelvic floor muscles, they lift the internal organs of the pelvis and tighten the opening of the vagina, anus, and urethra. The layers of the pelvic floor muscles stretch from the pubic bone at the front, where the line of your underwear sits, to the coccyx at the back, also known as our tailbone, and to each of our sitting bones. Pelvic floor muscle training, also referred to as pelvic floor exercises, are known to be effective in treating symptoms of urinary incontinence and pelvic organ prolapse. It is recommended for all women, especially during the antenatal care and following childbirth. This slide shows you where the pelvic floor is situated within our pelvis and that it acts as a bowl of support for our pelvic organs. There are many functions of the pelvic floor, which include support of the pelvic organs, control of our bladder and bowel, so the pelvic floor stops us from passing wee or poo until we are on the toilet, and it also has an important role in sexual function and helps increase our sensation during intercourse. It has a role in our breathing mechanics, and of course it's supportive during our pregnancies and childbirth. It's really important to look after yourself and your pelvic health, particularly in the first 6 weeks after giving birth. It's important to try and rest and spend some time lying down and offloading your pelvic floor muscles if you can, as this will help them to heal. Try to eat and drink well throughout the day. Diaphragmatic breathing, where you inhale through the nose and exhale through pursed lips. Practicing this daily can help with our pelvic floor and core activation as well as pelvic floor release. Pelvic floor exercises can start once you have done your first week after birth. You could factor in your squeezes when you're feeding your baby. Over the next 6 weeks, slowly increase the amount of time you can hold for. And lastly, try to delegate, ask for help, and avoid heavy lifting and constipation if possible. Bladder care. After giving birth, your first wee will be monitored. You will need to wee within 4 to 6 hours after giving birth. And if you've had a catheter, you will need to wee within 4 hours after the catheter has been removed. Once you are at home, make sure you keep an eye on your bladder. And can you ask yourself these questions? Do I have sensation that I want to pass urine? Is my stream normal? Did I pass a good volume of urine? And did my bladder feel empty at the end? Was there any urinary incontinence? Normal bladder function will range from a frequency between 6 to 8 times in a 12-hour period. If you have a sudden inability to pass urine despite a strong urge, usually with some pain or discomfort in your bladder or lower abdomen, then call 111 or go to A&E. With your bowel care advice, make sure to drink 1.5 to 2 litres of water-based fluid per day and avoid straining. Have a good diet, and the Bowel Health UK website has some really useful information regarding diet. The optimal position is a seated squat, where your knees are higher than your hips. Lean your body weight forwards with your feet apart and your forearms on your thighs. With your mouth open, breathe in deeply and relax your tummy muscles forward. As you breathe out, think of that back passage nicely relaxing to relax your anal sphincter. After birth, you may have had some stitches to repair any perineal tears or an episiotomy. Take regular pain relief for the first few days and try to keep the wound as clean and dry as possible. Only apply water to the wound and change your pad regularly. Make sure to wash daily in the shower, and after washing, pat the wound dry gently or leave it to dry naturally. Do not rub it with a towel. Try to avoid constipation and drink plenty of fluids to help dilute the urine. You can pour water on the perineum when you pass urine, and this will help to dilute the urine so that it doesn't sting as much and will keep the area clean. And remember to do your regular pelvic floor exercises, as this can help increase blood flow and help to heal the wound. Keep an eye out for infection or wound breakdown. If you have an infection, you may notice symptoms such as an increase in perineal pain, yellow or green vaginal discharge, stitches which are loose or separated, a feeling of being unwell or flu-like symptoms such as a high temperature, a burning sensation or pain around the wound site when passing urine, and a presence of redness, hardness, or swelling around the wound. If you think you might have an infection, contact your GP or health visitor. And if you are less than 28 days post-birth, call triage. If you are recovering from a cesarean birth, ask for your help with your daily tasks and allow time for you to rest. Gently clean and dry the wound daily as advised. Keep an eye out for any signs of infection like hot to touch, swelling, oozing, your wound opens up, there is a bad smell around the wound. Wear loose, comfortable clothes and cotton underwear. Having a rolled up towel nearby so that if you need to cough or sneeze, you can press it firmly on your wound to support can be helpful. Turn onto your side to get in and out of bed, and ensure you are completing your pelvic floor exercises after you've had your first week. Avoid heavy lifting for the first 6 weeks, and it is advised not to drive until you can wear a seatbelt comfortably and you can complete an emergency stop without hesitation. Returning to sexual intercourse can happen whenever you feel ready, but you may wish to wait 4 to 6 weeks for soft tissue healing and to prevent infection. Everybody will feel different about returning to sex, and it's okay not to feel up to it for a number of months. Communicate with your partner, as it may feel different. It can be useful to talk about what feels good and what doesn't. Use lubrication, as vaginal dryness is a common problem as your hormones readjust. And increase foreplay. Giving your vagina time to produce its own natural lubrication can be really helpful. And make time for sex so you don't feel rushed or anxious. Pregnancy can increase the load on our pelvic floor muscles, so strengthening them during pregnancy and after every pregnancy is essential. This is the same whether you've had a vaginal birth or a cesarean. To complete your exercises, squeeze the back passage as if you are trying to stop wind and squeeze and lift towards the front. Try not to hold your breath or contract your buttocks or legs, and let go fully when you have completed the squeeze. In the following slides, we will discuss the difference between your long holds and your short squeezes, but you must complete both. If you are experiencing any symptoms of pelvic floor dysfunction, like leaking urine, then you should complete these exercises 3 times per day. If you are symptom-free, you can complete once per day. Now we're going to have a practice at finding our pelvic floor muscles so we can get an idea of what we're being asked to do. Follow the steps on the slide, and it's nice to practice 3 to 4 contractions here. It's important never to try this whilst you are actually passing urine, as this may cause backflow of urine to your kidneys, cause an infection, and disrupt the normal way you empty your bladder. It can be very difficult to find these internal muscles, but keep trying as it will get easier. Make sure you tighten without pulling in your tummy, squeezing your legs together, tightening your buttocks, or holding your breath. There are 3 possible ways to check if you are contracting your pelvic floor muscles correctly. The first one would be to use a mirror. The area between your vagina and back passage, known as the perineum, should move up and inwards away from the mirror when you contract your pelvic floor. You can also feel inside your vagina with a thumb or index finger and tighten your pelvic floor muscles. You should feel the muscles tightening around your thumb or finger as you squeeze. If you are sexually active and having penetrative sex, you could try to squeeze your muscles during sex and ask your partner if they can feel the squeeze. When you are completing a pelvic floor exercise program, we encourage you to complete some long squeezes and short squeezes. When you squeeze and hold, time how long you can hold for whilst maintaining normal breathing. This may be 3 seconds, 5 seconds, or 10 seconds. There is no right place to start your hold, just do it for as long as you comfortably can. And relax fully between each repetition and repeat up to 10 times. Following on from your long squeezes, try the short squeezes. This is a quick squeeze followed by a quick relax. So after today, we would recommend getting into a regular routine of completing pelvic floor exercises. Return to exercise. Pregnancy and birth has a significant impact on your body. Everyone will recover at a different rate, and you should gradually build up your exercise tolerance at a pace that is appropriate for you and your body. It can take up to 9 to 12 months for your body to fully recover. Start with your pelvic floor exercises. Before you begin any other exercise, you want to make sure all vaginal bleeding has stopped, any wounds have healed, either perineal wounds or C-sections, and your pelvic floor dysfunction is improving or has got completely better. Every mum will vary, so it is important to go at your own pace and understand how your own body is feeling and recovering. If you are unsure or you do experience any symptoms of pelvic floor dysfunction, as you start to do more, then this would be a good opportunity to come and see us in clinic via the self-referral pathway. Between 0 to 6 weeks, the focus is all on rest and recovery. Start gentle pelvic floor exercises and diaphragmatic breathing daily. Begin short walks if you feel comfortable, and make sure you have no pain or vaginal heaviness during or after the walks. You may wish to start some gentle upper back mobility or stretches to counteract the forward position of feeding and carrying your baby. If you feel ready, you can start to integrate some basic core strengthening work. The Pelvic Obstetric and Gynecology Physiotherapy website has a booklet called Fit for the Future, which has some really helpful tips on where to start when it comes to strengthening your tummy muscles. Between weeks 6 and 12, the focus here is to start slowly rebuilding your muscles and getting them stronger. Getting an assessment from a pelvic health specialist would be advisable here if you do still have any symptoms of pelvic floor dysfunction after birth. Continue to work on your pelvic floor strength, upper back mobility and breathing, but now start to building some individualized core exercises and general full body strength using your own body weight. No running or impact style exercises are recommended at this time. Now, week 12 and onwards is the time where your full body, core and pelvic floor strength work can be progressed. Continue to work on breathing, upper back mobility daily, and your pelvic floor exercises, but if you'd like to return to impact style exercises such as running or heavy weights, it is important that you have no pelvic floor symptoms. Some women may not be able to return at 12 weeks to begin this sort of exercise, and that's okay. Focus on more of the strengthening or get some advice from a pelvic health specialist physiotherapist. Returning to any sort of impact exercise or heavy lifting should always be gradual, and you should continue to monitor for pelvic floor symptoms. This is an infographic by pelvic health physiotherapist Grania Donnelly. We put this in to help guide you with your return to impact exercise. Please note that everybody's journey and goals are different, and this is purely based on generic advice to help guide you. It is okay to stay at a certain level longer than is written on the diagram if this feels right for you. Remember, exercise shouldn't be causing you symptoms, and if you feel you need more tailored care, it would be a good time to seek support from a pelvic health physiotherapist. Regardless of the mode of birth, due to antenatal pressure of the pregnancy on the pelvic floor, dysfunction can occur. This can present as pain, weakness, and pudendal nerve injury. A vaginal birth, particularly an instrumental one, is more likely to have a significant impact on the pelvic floor in comparison to a C-section. And it can take some months for the pelvic floor to recover following a vaginal birth. The hormone relaxin, which is produced during pregnancy and whilst breastfeeding, has an impact on the pelvic floor as it relaxes the smooth muscle cells. This may delay improvement in symptoms for some women with pelvic floor dysfunction. Do you experience any of these symptoms shown on the slide? As you can see, there are many things that you may identify with which are known to cause or contribute to the weakness in the pelvic floor. This is why we encourage everyone to do pelvic floor exercises. If you find the pelvic floor exercises are not helping your symptoms, this is when you should seek further support. So where would you go if you needed further support? In the first 6 weeks or in hospital, the team are looking after you after birth. They can provide you some support. Your community midwives when you go home, your maternity emergency department or your triage team, and your health visitors. From 6 weeks onwards, your GP or health visitor can help, or you can self-refer throughout up to 12 months after giving birth. Remember, your pelvic health is for life, so please continue with your pelvic floor exercises once daily, lifelong, to maintain the strength you have built. There are lots of pelvic health services available if you experience symptoms later in life or beyond your 1 year postnatal period, where you can refer to us. Thank you for listening to this recording today, and we hope you found the information and advice useful. If you have any concerns, please feel free to get in touch with us. You can also find some helpful information in the booklets on the QR codes on this slide. Thank you.